Hello everyone, welcome back to Wonder Science. Today we're going to be learning about sun safety and skin cancer. We're going to learn about all the different types of skin cancers and also the risk factors of getting a skin cancer and some prevention tips that will help you when you're being exposed to the sun and to prevent yourself from getting these type of skin cancers. So first off, how do people get skin cancer? Skin cancer is commonly caused by overexposure to sunlight, especially when results in sunburn and blistering. The sun's ultraviolet UV rays break the DNA in your skin, causing abnormal cells to grow. And these abnormal cells are going to grow, divide, and expand really quickly in a very disorganized manner, and it's going to generate a mass amount of cancer cells. The average age of patients diagnosed with cancer is around 65 years and above, but it is not unusual for skin cancers to develop in people from younger ages, for example, 30 years and below. It is always important to be safe and to take proper precautions when being exposed to the sun and to have the proper sun safety methods so you can prevent yourself from getting these skin cancers at any age, whether it be 30 or 65 or any range in between. So UV radiation levels. UV levels vary depending on the time of day, the time of year, and the latitude. It can also vary depending on the altitude, weather conditions, environment reflection, and also the ozone. So UVA rays are premature aging. UVB rays is the cause of sunburn, and skin type is going to affect the degree people burn. Lighter skin people are going to burn more easily than darker skin people. Use sunscreen with SPF, which stands for sun protection factor of 30 or more, as it'll make sure you're more properly protected from the UV rays. And also keep in mind that SPF 30 is not twice as protective as SPF 15. So the different types of skin cancers that we're going to talk about today is basal cell carcinoma, squamous cell carcinoma, and melanoma. 1 in 5 Americans will develop a skin cancer of some sort. So first off is basal cell carcinoma. It is a lightly pink or flesh-colored pimple with pearly or waxy appearance. Is very typical for what it's supposed to look like, and they spread slowly and almost never deadly. This is the least death rate out of all of the 3 skin cancers. But if it's left untreated, they can develop to a point that disfiguring surgery is required to remove them. Common location would be the face, the scalp, neck, and the back of the hands. Okay, next up is squamous cell carcinoma. They often start off as flat red or brown splotches, which become rough, dry, and scalpy. Again, if not treated, may ultimately develop large enough to spread surrounding internal organs, and this one can be fatal. More common locations be the head, the neck, again, back of the hands, and the lower legs, which is more commonly found in women. Next up, melanoma. This is the most deadliest skin cancer, and it has the highest death rate by unanimous amount. It may happen everywhere on the body, including locations that haven't even been exposed to the sun. They frequently develop in regions of the skin that have had occasional and severe sun exposure, but it is not uncommon for it to be found anywhere on the body, like the torso, head, neck, upper back, and then lower legs. And then next is we're going to learn about the ABCDs, which stands for asymmetry, border, color, diameter, and evolving. Yep, so right here, A would stand for asymmetry, B for border, C for color, D for diameter, and E for evolving. Asymmetry. Most melanomas are asymmetrical, so we want to remember to make sure if we see like some mole, if it's asymmetrical, to make sure we know that could be a sign of melanoma. And also keep in mind that melanoma borders tend to be uneven and have scalloped or notched edges, just like the picture, the second melanoma blotch on the image. And then C, color. Multiple colors are a warning sign. Melanoma may have different shades of brown, tan, or black. So keep in mind the color. D is diameter. While it's ideal to detect a melanoma when it's small, it is a warning sign if a lesion is the size of a pencil eraser, which is about 1/4 inch of a diameter or larger. So keep in mind about the diameter, just like that image again. And then evolving. Any change in size, shape, color, anything that grows or changes or like the elevation of the spot or the spot on your skin may be a warning sign of melanoma. So whenever you see like a mole or some abnormal looking splotch on your skin, make sure to remember the ABCDs of melanoma, ABCDEs of melanoma: asymmetry, border, color, diameter, and evolving, because it is very important to catch the melanoma early before it can become very fatal. Risk factors of skin cancer: any atypical moles, even one, more than 50 normal moles, light complexion, blonde or red hair, and blue, green, or hazel eyes. Also, a history of blistering sunburns under the age of 20, personal or family history of any type of cancer, melanoma, basal cell, squamous cell, any type of skin cancer, sudden exposure of normally covered skin to strong sunlight, and regular use of tanning beds 10 times more in a year. Tanning beds are very unhealthy. They might make you look better, but it's very unhealthy for your skin and is one of the leading causes of skin cancer. So some sun safety behaviors: minimize exposure to the sun from 10 a.m. to 4 p.m. Avoid tanning beds. Wear protective clothing, including maybe like a wide brimmed hat which covers your face. And make sure to use SPF of 30 or more with both UVA and UVB protection. And consider having atypical moles removed if they are in areas which you are not likely to notice every day. Okay, so that is all that I've had. These are my sources where I got all my information if you wanted to look more in depth into it. But overall, just make sure you're wearing sunscreen, protective clothing, avoiding tanning beds to prevent yourself from getting these very deadly, or they just are very annoying to have and can cause surgery and can be fatal. So make sure we're protecting ourselves from the sun exposure, because right now it's the summertime, we're all outside. So we want to make sure that we are preventing ourselves from getting these skin cancers and taking the best sun safety precautions that we can. So I hope you all learned something from this video, and be safe the rest of the summer, and I'll see you guys next video. Bye.